So concentration, persistence, and pace as our third category or dimension. Speaks to sustained focus of attention for task completion. That's more or less the definition in the guides. And it pertains to different contexts. It includes to the context of the workplace, the home, as well as formal examination. So in terms of the workplace aspect, obviously the situational work assessment that we're about to talk about, we can certainly gain a lot of insight in terms of this dimension during the one-day situational work assessment. Certainly in terms of formal examination, if the individual is unable to complete our half or full day test battery, and that seems to be again grounded in the pathologies that would be rated here, and this includes chronic pain disorder as well as depressive disorders, post-traumatic stress disorder, and the like, as well as in the home context. So to what extent is the individual able to basically set goals and work towards achieving those goals, being able to persist, pace themselves, have the stamina towards task completion. And our fourth dimension, adaptation, or the flip side, is deterioration in a work-like setting, the situational work assessment. So again, failures to adapt to stressful circumstances, indicated by problems with making decisions, attending, task completion, interactions with others, as well as maintenance and adherence to schedules, for example. So what we oftentimes try to do with the situational work assessment to make up for the fact that there's typically, or there may not be funding to do a second or a third day, is we try to make it maybe the second or the third day after the OT in-home, after the psychological assessment. So try to build in some, pressures, some stressors that reflect more than a single day assessment. Okay, if you can structure it that way, then that gives a situational assessment that much more impact by considering kind of the buildup of stressors from the prior couple of days. Withdrawal from the situation, so individuals that need to take increasing breaks. Certain people that need to maybe have a sleep during a break or during a lunch. Their signs or symptoms are elevated, certainly signs of tearfulness, increased pain behaviors that you have judged as being genuine, as well as deterioration in the other three domains, which is why it's important to identify, by having the OT make a phone call to find out how the client is done over the subsequent days. So subsequent days, basically they've now spent the next couple of days in bed, next couple of days withdrawing from other people, next couple of days just disengaged or much less engaged. These are all indications of deterioration in their adaptive capacity for you to consider.